In this video, we will be discussing about the sensory supply of the trigeminal nerve. We will discuss about the branches of the sensory division of the trigeminal nerve. We will also discuss the muscles which are supplied by the trigeminal nerve. So we will first discuss the sensory supply of the trigeminal nerve. In that, we will discuss the branches of the ophthalmic division of the trigeminal nerve. So I'll draw the diagram first. So we know that the ophthalmic division of the trigeminal nerve divides into three branches in the lateral wall of the cavernous sinus. These three branches are the frontal nerve, the lacrimal nerve, and the nasociliary nerve. These three divisions passes through the superior orbital fissure and they leave the middle cranial fossa to enter into the face. In the face, they divide into so many branches and supply the one part of face. So it emerges through the superior orbital fissure, and the frontal nerve, it passes like this and divides into two terminal branches. This is the frontal nerve, and the two terminal branches are. We are discussing about the frontal nerve. This one is frontal nerve. The two terminal branches of the frontal nerve. This one which is located medially is known as supratrochlear nerve. The supratrochlear nerve, it will be supplying the upper skin over the upper lid, skin over the lower forehead. So the supply is skin over upper eyelid, skin over lower forehead. Then one branch which is located laterally is the supraorbital. Second one is supraorbital nerve. Look at the nerve, it will be supplying the skin over the upper eyelid, the skin over the forehead, and it will also supply the skin over the scalp up to the vertex. So supply is skin over upper eyelid, then forehead, skin over the forehead, frontal sinus, skin of scalp up to the vertex, so this is about the frontal nerve, which is a branch of ophthalmic division. Next branch of the ophthalmic division of the trigeminal nerve is lacrimal nerve. The lacrimal nerve comes here and supplies the skin over the lateral aspect of the upper eyelid. So second one was the lacrimal nerve. It also supplies secretomotor fibers to the lacrimal gland. So lacrimal nerve, it will be supplying skin over the lateral part of upper eyelid. And also secretomotor fibers to the lacrimal gland. And the next branch was, so this one was the lacrimal nasociliary. It has got so many branches. The nasociliary comes here and gives a long ciliary branch. So this one was a nasociliary, long ciliary nerve to the eyeball. Next it comes here and it gives another branch which is known as the infratrochlear branch. After giving the infratrochlear branch, it gives a posterior ethmoidal nerve. Then it comes like this and gives out a anterior ethmoidal nerve. The anterior ethmoidal nerve divides into an internal nasal and external nasal. This is the internal nasal and this is the external nasal branch. So the nasociliary gives first branch, that is A, labeled as A. The third branch of the ophthalmic division is nasociliary. Nasociliary now. It gives the first branch, that is the long ciliary nerve, which is supplying what? Eyeball. And the second branch we have discussed is infratrochlear. This is the infratrochlear, which is labeled as B. B is infratrochlear nerve. So the infratrochlear nerve, as you can see here, it supplies the skin over the medial aspect of nose, the skin over the medial aspect of the upper and lower eyelids, and it also supplies the lacrimal sac, which is located on the medial aspect of the eye. So it supplies the skin over medial part of both eyelids and medial skin of medial aspect of nose, skin of medial aspect of nose, and the lacrimal sac. Lacrimal sac. And next branch of nasociliary, you can see here, that is labeled as C. C is posterior ethmoidal nerve. Posterior ethmoidal nerve, which will be supplying the posterior ethmoidal sinus and the sphenoid sinus. So it supplies posterior ethmoidal sinus, posterior ethmoidal and sphenoid sinus. Next branch is anterior ethmoidal branch, so which is labeled as B. This branch comes downwards. This is anterior ethmoidal. So you will see that the anterior ethmoidal comes here and divides into two branches, the internal nasal and external nasal. So the first branch, which is known as the internal nasal. So this one is the internal nasal. This is labeled as E. So E is the internal nasal branch of anterior ethmoidal. So the internal nasal branch, it will be supplying the anterosuperior part of nasal septum and the lateral wall of nose. And F, another branch, which is the external nasal, labeled as F, external nasal branch, which supplies the skin of the nose up to the tip of nose. Skin of nose up to the tip. So that's all about the ophthalmic division of the trigeminal nerve. Next we will discuss about the branches of the maxillary division of the trigeminal nerve. So discuss about the maxillary division. So for that we will draw the diagram again. We know that the maxillary division of the trigeminal nerve is also purely sensory nerve. It emerges from the middle cranial fossa through the foramen rodentum. So it emerges out through the foramen rodentum, and it also supplies the dura of the middle cranial fossa and the anterior cranial fossa. So after emerging through this foramen is foramen rodentum. So through this foramen it leaves the middle cranial fossa. After leaving the middle cranial fossa, it enters into a region which is known as the pterygopalatine fossa. So in the pterygopalatine fossa, it will give out some branches. We'll first discuss the branches given out in the pterygopalatine fossa. Branches in pterygopalatine fossa. So we know that here a ganglion is located, that is the pterygopalatine ganglion. The nerve gives out a branch to the pterygopalatine ganglion. So this branch is known as the ganglionic branch. So ganglion, it gives out a branch which is labeled as A. So A is ganglionic branch. And it gives out sensory branches here. These are known as zygomatico-temporal and zygomatico-facial. So which is labeled as B. These are zygomatico-temporal and zygomatico-facial. Zygomatico-temporal and zygomatico-facial, which supplies the skin over the temporal and the facial regions at the region of zygomatic bone. Zygomatico-facial. Another branch which is given out in this region is known as posterior superior alveolar nerve. This is labeled as C as posterior superior alveolar nerve. Posterior superior alveolar nerve. So we're looking about this. This is the upper jaw, this is the lower jaw. Upper jaw containing the teeth, lower jaw containing teeth and gum. The posterior superior alveolar nerve supplies the molar teeth, upper molar teeth and adjacent gum. And it also supplies the posterior wall of maxillary sinus. So supply of this is upper molar teeth, upper molar and adjacent gum, and also posterior wall of maxillary sinus. So that's about the posterior. Next, the next part of the nerve is in the infraorbital canal. So the nerve from the pterygopalatine fossa, it enters the infraorbital fissure and it enters the infraorbital canal. So this is the infraorbital canal, and in this canal the nerve is maxillary nerve is known as infraorbital nerve. So we are discussing about the branches of infraorbital nerve. Branches of infraorbital nerve. Here it gives out branches like middle superior alveolar nerve, that is labeled as D. So D is the middle superior alveolar nerve. The middle superior alveolar nerve, it will be supplying the upper premolars and the adjacent gum, the lateral wall of maxillary sinus. So upper premolars and gum and lateral wall of maxillary sinus. Lateral wall of maxillary sinus. The next branch is anterior superior alveolar nerve. So this is the anterior superior alveolar nerve, which is labeled as E. E is anterior superior alveolar nerve. The anterior superior alveolar nerve, it supplies the upper incisors and canines and adjacent gum, also the wall of the maxillary sinus. Besides that, it also supplies the anterior inferior region of lateral wall of nerves. So it is also supplying the anterior inferior portion of the lateral wall of nose. You can see this branch supplying the lateral wall of nose. So supply is upper incisors and canine and the adjacent gum, canine and adjacent gum, and also wall of maxillary sinus and also the anterior inferior part of lateral wall of nose. This is important, anterior inferior part of lateral wall of nose. After running through the infraorbital canal, the nerve emerges out through the infraorbital foramen. This is the infraorbital foramen. Emerging out through the infraorbital canal, it reaches the face. So, what are the branches which are given in the face? Discuss about branches in face. After coming out of the infraorbital foramen in face, after coming out through the infraorbital foramen, it divides into three terminal branches, which is one is the palpebral branch, another one is the nasal branch, another one is the labial branch. So which is labeled as F is the palpebral branch. Palpebral branch, which is supplying the medial aspect of skin over the medial aspect of both eyelids. Skin over the medial aspect of the lower eyelid. Palpebral branch, which is supplying the skin over medial part of lower eyelid. And there is a nasal branch which is supplying the skin over the ala of nose and the vestibule of nose. Skin over ala of nose and vestibule of nose. And next branch is, this is labeled as G, and next branch is labial branch, which is supplying the skin over the upper lip, which is labial branch, which is supplying the skin over the upper lip. That's all about the branches of maxillary division of the trigeminal nerve. Next we will discuss about the branches of the mandibular division of the trigeminal nerve. So, branches of mandibular division. We will again draw the diagram. We know that the mandibular division of the trigeminal nerve is a mixed nerve. The ophthalmic and maxillary was a purely sensory nerves. This one is a mixed nerve because it carries the motor fibers also from the motor root. So the mandibular nerve, it leaves the middle cranial fossa through the foramen ovale, and leaving the foramen ovale, it carries the motor root also along with the sensory root. It reaches the infratemporal region. So in the infratemporal region, there are nerves which are arising from the trunk. First, nerves or branches from the trunk of the nerve. So from the trunk, there is a branch which is labeled as A is nervus spinosum, which is passing through the foramen spinosum and supplies the dura of middle cranial fossa. MCF is middle cranial fossa, and there is branches to the medial pterygoid And there is branches to the medial pterygoid, and also it supplies the tensor tympani and tensor velar penetrani to the otic ganglia. So branches to the medial pterygoid, branches to which are muscles medial pterygoid and through otic ganglion it supplies two other muscles which are tensor tympani and tensor velar palatine. Tensor velar palatine. So now discuss about the other branches. The tongue appears here and the mandible. The tongue divides in an anterior and posterior division. This one is an posterior division of the nerve, and this one is the anterior division of the nerve. So the anterior is the anterior and posterior division. We can discuss about the branches arising from the anterior division. So the branches arising from the anterior division are mainly motor to muscles like lateral pterygoid, masseter, and deep temporal branches to the temporalis muscle. These are the motor fibers. And next one is this anterior division has a single sensory branch that is known as, so these are the muscular branches to the deep temporal to the masseter, and it gives out a sensory branch which is labeled as C. C is known as the buccal nerve. The buccal nerve will be supplying what region? Skin over the bassinator muscle, skin over bassinator. It supplies the mucus of cheek and the vestibule of mouth. Vestibule of mouth. So these are the branches from the anterior division, and we will discuss the branches from the posterior division. So from the posterior division. So from the posterior division, you see that if this is a tongue, underneath the tongue there is one branch from the posterior division that is known as the lingual nerve. So this nerve, which is labeled as D, is lingual nerve. Lingual nerve. So the lingual nerve, it passes underneath the tongue and it is joined by the chordae tympani nerve, which is a branch of the facial nerve, and it carries sensations from the anterior two-thirds of tongue. Anterior two-thirds of tongue. It joins with the chordae tympani, hence it supplies secretomotor fibers to the submandibular salivary gland. Supplies secretomotor fibers to the submandibular salivary gland. Secretomotor fibers to submandibular gland. So other branch which is arising from the posterior division is the inferior alveolar nerve. The inferior alveolar nerve, it runs through the mandibular canal of the mandible and it supplies teeth of the inferior alveolar region. All the teeth are supplied of the lower jaw. All the teeth of the lower jaw is supplied by the inferior alveolar nerve, and the adjacent gum is also supplied. Then it emerges out through the mental foramen as a mental nerve. As a mental nerve, it will supply the skin over the chin. So this is labeled as C. So C is inferior alveolar nerve. Inferior alveolar, it passes through the mandibular canal. It supplies the teeth of the lower jaw. Teeth of lower jaw and gum. All the teeth, lower jaw and gum. And it emerges out through the mental foramen. As the mental nerve, it supplies skin over the chin. And the inferior alveolar nerve also gives out branches to the mylohyoid vessel and also the anterior belly of digastric. It also has a branch which is giving branches to the mylohyoid and anterior belly of digastric. So anterior belly of digastric is supplied by the mandibular division of the trigeminal nerve. Anterior belly of digastric. And there is another branch which is arising from the posterior division, and that branch is known as the auriculotemporal nerve. The auriculotemporal nerve, this is labeled as D. So D is auriculotemporal. Now, so now that the auriculotemporal nerve is supplying the skin over the lateral aspect of the auricle, it is supplying the anterior inferior portion of the external auditory canal, lateral part of the tympanic membrane. So supplies skin over lateral part of auricle, anterior inferior portion of external auditory canal, lateral part of tympanic membrane. And important point is that it receives postganglionic parasympathetic fibers from the otic ganglion. Parasympathetic fibers from otic ganglion to the parotid gland. So we know that the mandibular division of the trigeminal nerve is a mixed nerve. It supplies the muscles of mastication and also the muscles which are derived from the first brachial arch. So when you are asked about the nerve of the first arch, it is definitely the mandibular nerve. So it is also known as the nerve of the first arch because it is supplying the muscles which are derived from the first brachial arch, like anterior belly of digastric, and it also supplies the muscles of mastication like masseter, pterygoid, temporalis muscle. So ophthalmic and maxillary are purely sensory, while mandibular is a mixed nerve. We know that the trigeminal nerve is a mixed nerve carrying sensory and motor fibers, and it is the largest cranial nerve. So that's all about the branches of the sensory division of the trigeminal nerve. Thank you for watching this video. To see more videos from our channel, please subscribe our channel. Thank you.